Hello everyone. In this video we will talk about the ATLS classification of hypovolemic shock. So what happens in a hypovolemic shock is that there is some sort of a fluid loss or blood loss from the body. Now depending on how severe the shock is, it can be classified into class 1, 2, 3 and 4. Class 1 is mild, class 2 is compensated because the body's mechanisms try to compensate for the blood lost. But in class 3, the body is no longer able to keep up with the amount of fluid lost, and so it is called decompensated shock. Eventually, class 4 is severe grade of shock. If we look at the percentage of blood lost in these classes, in class 1, there is a less than 15% loss of total blood volume. In class 2, 15 to 30% of the body blood volume has been lost. In class 3, 30 to 40%, and in class 4, more than 40% of the body's blood volume has been depleted. In class 1, the pulse rate is usually normal and it starts to rise mostly by class 2. So pulse rate first rises in class 2 shock. Eventually it increases even more and is the maximum in class 4 shock. Blood pressure is normal in class 1 and in class 2 as well because it is compensated. But it starts to first decrease in decompensated shock or in class 3 shock, and it is very low or might be even unrecordable in class 4. The pulse pressure is more or less normal or might even be increased in class 1. It is decreased in class 2, 3 and 4. If we look at the mental status of the patient would be slightly anxious in class 1, mild anxious in class 2. The patient will be confused in class 3 and lethargic or unresponsive in class 4. Urine output of a patient is more or less normal in class 1. It starts to decrease in class 2 and by class 4 the urine output decreases to very low. Respiratory rate is a little raised in class 1 shock and it is severely raised in class 4 shock. It eventually keeps on increasing. The base deficit is normal in class 1 and it also increases by the time we get to class 4. So the main thing you have to look at in these classes is that your pulse rate, respiratory rate and base deficit keep increasing as we go through the stages and as the shock gets more severe. Whereas blood pressure, pulse pressure and urine output keep decreasing. For management, class 1 shock, since the patient is more or less stable, you can just give oral fluids. For class 2 shock, IV fluids have to be given in the form of crystalloids. In class 3, IV crystalloids and colloids both may be needed, but in class 4, since it is the most severe form, we have to replace the blood by blood transfusion.